Honorable Minister.
Thank you. Order. Thank you, Honorable Speaker. In reply to the question to the member, Matatiele forms part of the Maluti sub-district, which is part of the Eastern Cape province. There is no intention by the Eastern Cape Department of Health to punish the people of Matatiele as a result of their wish to be part of KwaZulu-Natal. The mandate of the Department of Health is to render the required health services to the people of Matatiele as we do elsewhere. And that's what the Department of Health intends on doing. The sub-district has got a total of 19 clinics. Unfortunately, operational managers' posts in 12 of the 19 clinics remain vacant, in spite of all efforts by the Department of Health in the Eastern Cape to recruit and retain professional staff. Honorable Member, this problem of inability to attract staff to rural areas is not only a problem of Matatiele, it's a problem of all rural areas in South Africa, and even in other parts of the developing world. It is a subject that is usually discussed at the World Health Assembly in Geneva every year, when ministers of health meet. How do you deal with the problem of staffing in rural areas of this world? Solutions have been proposed. There is even a resolution on human resources by the World Health Assembly in trying to deal with this issue. I'm giving this background for the honorable member to understand that some of the health problems that may be experienced by our people in Matatiele occur in similar such settings around the world, and have got nothing to do with boundaries between KwaZulu-Natal and Eastern Cape, as the honorable member is suggesting. If, however, the honorable member is deliberately reducing every single problem of humanity experienced by humanity experiences as caused by boundaries between provinces, I don't think we should join that honorable member in that fruitless and misleading crusade. As a department, we'll prioritize the filling of posts of operational managers and all other staff by our health facilities. It is for this reason that for the past 18 months, we have sent teams to all our clinics in the country to calculate staffing norms in line with a formula determined by the World Organization, a formula that is called WISEN. We have just finished all our primary health care facilities. What is left is implementation as soon as we finish with the tertiary and quaternary level. Honorable member, acting allowances are paid to all acting managers in line with existing policy. That is when a post is vacant and funded. All clinics in the sub-district are operated by professional nurses. The Nyaniso clinic has been approved and the rebuilding process is scheduled to start this financial year. Thank you, honorable member. Thank you, Speaker.
Honorable Chafta. Honorable Chafta. Ageko.
Thank you, Honorable Speaker. Honorable Speaker, I disagree with the minister that the province of the Eastern Cape is giving the support it's supposed to give to the area of Matatiele and Maluti. And I'm sure that the minister visited the area and have seen the state of the clinics in the area, that is especially in rural areas there. I'm having one or two questions, follow-up questions, Honorable Speaker, that the minister, having seen these conditions of those clinics, what measures is he having in place to save the situation and to ensure that the province is giving the support the area deserves? Thank you, Honorable Speaker.
Honorable Minister.
Honorable Speaker, indeed, I did visit Matatiele. I visited several clinics, so I also know what I'm talking about. And there are two things that are going to happen. The first one is what was announced by the President during the State of the Nation address about the big fast results, SASSA, which is now in the Department of Environmental Affairs. The next one is coming to health. And we've dedicated that to making our clinics ideal in terms of infrastructure, equipment, and everything. The second thing is that we do have a new program on norms and standards on infrastructure, not only for Matatiele, for the whole country. And we are busy applying those norms and standards for the whole country on what our infrastructure must look like. That will solve the problem in that part of the country. Thank you.
The Honorable Volmink.
Thank you, Honorable Speaker. Honorable Speaker, Matatiele has 1 hospital, 1 TB hospital, 19 clinics, and 2 mobile clinics. Given its population, it should have 5 hospitals and 43 clinics, leaving a backlog of 3 hospitals and 22 clinics. In addition to rebuilding the clinic destroyed by the tornado, would the Honorable Minister tell us precisely when the construction of the additional 3 hospitals and 22 clinics will be completed? Or will the people there have to languish under the slow march of bureaucracy? Thank you.
The Honorable Minister.
Honorable Speaker, I don't know what formula he was using to calculate these 5 extra hospitals, clinics, etc. Yes, I'm not sure, but in the Department of Health, for the past 3 years, Honorable Speaker, we've been mapping all health facilities to prepare for NHI. If he comes to the department, I can show him the map. Fortunately, he's a member of the portfolio committee. I'll show him what we have mapped for each municipality, each district, each village in the country, in terms of what is needed. I don't have it in my head that Matatiele needs 5, because I don't know what formula he's using. If it is true that that's what it needs according to our formula, then we'll go on and do that, because the reason that we did that mapping was because we wanted to correct the problems. Thank you.
The Honorable Nkomo. The Honorable Nkomo.
Thank you, Speaker. My question states that what methods are used by the department to attract managers in healthcare services in Matatiele and other areas? By not having these health managers, how does this impact on the quality of services? The second area is that, is the department intending to roll out mobile clinics in Matatiele and other deserving areas so as to alleviate pressure placed on the few available clinics? Thank you.
Honorable Minister.
Honorable Speaker, I don't know why I should keep on answering the same question, because I've just outlined here, not only for Matatiele, that in the department, in preparation for NHI, we have mapped the whole country using a particular formula. If that area needs mobile clinics or needs a permanent clinics, etc., it will show on that structure and we'll do something about it. That is why, Honorable Speaker, in the manifesto of the ruling party, we said we are going to build 216 clinics, 43 extra hospitals, and renovate 816 new ones. It's because we have got plans. And all you need to do is to be patient for us to implement those plans. Thank you.
The Honorable Litchfield Shabalala.
Thank you, Honorable Speaker. While a clinic is set up to treat mild to moderate healthcare problems, and while it might contain some diagnostic machinery, the truth is it is always not enough. It is a fact that hospitals provide a more stable and multidisciplinary approach to healthcare. Although it would seem that African governments, including South Africa, prioritized clinic over hospitals in black areas, a critique which some attribute to the borrowing conditions of the IMF and World Bank. Question, Minister. Do South African health outcomes suffer from reduced health spending, including other health inputs like reduced food subsidy or even reduced public health spending, including capped public health salaries, all of which coincidentally happen to be conditions placed upon third world countries when they borrow money from the IMF and World Bank? I thank you.
The Honorable Minister.
I don't know this model of yours of believing hospitals are always superior to clinics. Our healthcare system, which is the system that is encouraged by the World Health Organization, starts from the bottom at primary healthcare level. It goes to the clinics. It then moves to district hospitals. It then moves to regional hospitals, then to tertiary hospitals. We are not going to put a hospital in every corner of the country and believe that we are going to call that healthcare. It cannot be. In fact, when we release the white paper on NHI, we are going to show that the heartbeat of the healthcare system is primary healthcare, which means prevention of diseases and promotion of health. That starts right in the village. That's why we are busy hiring community health workers for each ward in a municipality. Our healthcare system is not hospice-centric. In fact, what you are saying is a hospice-centric healthcare system, which is actually being discouraged because it escalates costs unnecessarily, but it doesn't have good results on the other end. So our building clinics is a best model of healthcare in the country. Thank you.
Honorable members, we have been informed that question number 77 that was asked by the Honorable Mahlalela has been withdrawn. Question number 48 has been asked by the Honorable A.T. Lovemore to the Minister of Basic Education. The Honorable the Minister.
Thank you, Speaker. Speaker, the answer is that the provision of post to schools is determined through a formula of post-provisioning on norms, and it's not, okay. It's good that you're listening. I thought you didn't even have the capacity to listen, so congratulations. So the provision of post to schools is determined in terms of post-provisioning norms and distributed through post-provisioning models to schools.
Honorable Chairperson, on a point of order.
What's the point of order?
The Honorable Minister is saying that there are people with no capacity to listen. I think that she must withdraw that respectfully.
Honorable
Please.
Minister, did you say that?
Because we could not hear what she was saying.
Withdraw.
Was saying,
For what
Mike,
it's meant, I withdraw so that
Thank
there's
you.
progress. For what
She
it's
has
worth.
withdrawn, okay.
So the vacancies can only be determined in relation to the Gazette post-establishment as determined by these norms. So as the end of June 2014, there were 3,202 vacancies in the gazetted post-establishment of schools in the Eastern Cape, indicated as follows. There were vacancies of 59 principals and vacancies of level 1 PL teachers, totaling 810 teachers, and unfilled vacancies were 2.4. The next question, the answer, Chair, is that the Eastern Cape and the Eastern Cape Department of Education has compiled a list of 1,117 critical vacant unfilled posts at level 1, which are earmarked for immediate filling. And these include math, science, and accounting. And then on B, the target for filling all these vacant posts, I had sent a memorandum to all provinces instructing them to fill all these vacant posts by the 31st of December 2014. So we will be able to report on progress after the date because it's provinces that fill posts, not national, because the budgets go to provinces. So I can only give directives.
The Honorable A.T. Lovemore.
Thank you, Madam Speaker. Minister, there are 3,202 teacher vacancies in Eastern Cape schools. Thousands of vulnerable learners in no-fee schools have not had a teacher in 9 months. The entire school year thus far, you and the ANC government in the Eastern Cape have been taken to court on this very issue. You were forewarned. Now, we know that the teachers that are available have been assigned to teach grade 12, but what minister of every other grade? Are they going to be passed to the next grade despite not complying with learning requirements, or they're going to be forced to repeat their grade next year? Neither option is in the best interest of the child. They need teachers, and they need them now. Can you guarantee, this province is under administration, Minister, it is your responsibility. Can you guarantee that this awful scenario will not recur next year?
Honourable Minister.
Chair, it is indeed the number as the member filled. When she was in the department, I also explained to her what the process is, but I think we're in the House, so she wants to get her colleagues also to hear. The point of the factor is, MEC, Speaker, which I explained to the member, the province had run short of resources. What it did, we had to go back to Treasury to request Treasury to reprioritize funds to fill in, to enable the province to fill in these posts. So indeed, the Deputy Minister is not even here, he's assisting the province, so she's away, he's assisting the province to fill in these posts. So in terms of intervention, if I can remind the member, because she was here last year about what the intervention is. The intervention is not everything, member, so don't keep on throwing things which you know are not true. The intervention is looking at school nutrition, scholar transport, HR and finance. It's not about the filling of posts, just to remind her for the record, but this matter has been dealt with and she is aware.
The Honourable Mashabela.
Honourable Minister, 9 out of the 18 schools which scored a 0 matric pass rate in 2009 are in the Vembe district of Limpopo, a direct reflection of the inferior education the ANC government offers the black child, despite its quantitative claimed victory of 78.2 pass rate in 2013. Questions, Minister, what then happens to the learners who are failed by your education system without NSC or other means to sustain their lives? Tell us if the 140 teacher vacancies in the Eastern Cape have been filled by permanent teachers. What is the time frame for temporary teachers to be migrated to permanent employees?
Honourable Minister.
Chair, I can say Vembe is one of the best performing districts in the country and in that province. So the 9 out of 8, I don't know where she gets it, and unless she gives you information. So for people to come with ambush and bring you numbers that you don't know, I don't know what she's talking about, but I'm sure she knows what she's talking about. What happens with the members, with people who have not succeeded, and it's not me who said it. Do you want me to repeat it? I heard it from that side saying that person is going to join the EFF. No, it's not. We're going to have them repeat so that they pass. We really don't throw them so that they succeed. So if they repeat, it's not me who said it. I heard from that side that they join the EFF if they fail. And I'm saying they don't. We want them to come back so that we can support them to pass, because every child is an asset, Speaker. Therefore, we do want to have them pass and do whatever we can. But these other stories, I don't know what the member is talking about.
Point of order.
What's the point of order?
The minister must address the question, must not address EFF.
Honourable Minister, you finished. Okay. The Honourable Van der Walt.
My vraag is in Afrikaans, minister. Agbare Speaker, ek wil graag hê die minister moet aan die huis vertel watter planne sy tans in plek het om die kritieke tekort in die Oos-Kaap aan onderwyser wie se medium van onderrig Afrikaans is op te los voor die 2015 akademiese jaar begin. Ook in die skole waar ons sien dat leerders wegbly van die skool omdat hulle nie 'n Afrikaanse onderwysers het nie. Dankie.
Honorable Minister. Looks like the translation was not spot on, eh? Honorable Minister.
No, Chair, as I said, the filling of posts, it's a provincial competency. You see, so you and me should be asking the province of the Western Cape when it's going to fill the posts. Or Eastern Cape, what's brought from Eastern Cape? No. Okay, I get to say that I get to say that ons werksaam met die provincie om onderwysers te kry, die deputy minister is daar om saam met die provincie werk so that they can help to get this thing resolved.
Honorable Mponchane.
Thank you, Honorable Speaker, Honorable Minister. I'm aware that the original question confines the Honorable Minister to the Eastern Cape. However, the Minister knows, as I do, that teacher vacancies, the problems are not peculiar to the Eastern Cape. These vacancies occur for different reasons. You have, in certain instances, principals who are displaced from their schools for different reasons, from witchcraft, where communities just chase the principal away from their communities. And some vacancies occur because teacher unions want to peg their schools with one of their kind. They cannot employ any other person other than one of their kind. Now, my question, Honourable Minister, if these are the factors which give rise to teacher vacancies, what has been or what would be your reaction, especially to teacher unions not wanting any other person to occupy that vacancy? I thank you.
Honorable Minister.
Thank you, Speaker. Ubaba uMpontshane sengiphendulele eminye imibuzo waMpontshane. Njengoba uthi ukuthi ivezwa ngezizathu ezihlukene, okunye inkolelo, so sihamba siyochela sihlabe ukuthi kwehla umoya uthisha abuye, so sebenzisa indlela ezihlukene ngokuthi uthisha uxoshwe njani, uma khona inkolelo senza into esazi ukuthi izosusa mhlambe lento ebasindayo esikoleni ngothisha kusebenzwe leyo ndlela ke sihambe siyohlaba sicele kwabaphansi ukuthi bavuma uthisha abuye ke mayihambe so sebenza indlela ezihlukene uhambe njani njengoba sowutsho nje so sebenza indlela ezihlukene ke ngasho ke
please.
Now come to question number 90 that has been asked by the Honorable Munguni to the Minister of Basic Education. Honorable Minister.
Thank you very much, Speaker. In terms of honor readiness, we are as ready as could be. We are very ready because we are starting now during the month of September. So all affected schools and provinces are ready. They've been given all the necessary tools to ensure that they are ready. We will be ensuring that more than 7 million learners will be writing the ANA test. We do expect some improvement that we've been seeing year on year, but what is very important about the ANA test is to really help our sector to focus on the level that matters most, which are your foundation phases, and indeed to get parents paying more attention, schools understanding what are the levels that are expected. So we don't only look at the marks as a benchmarking exercise, but the whole sector itself being able to understand what is expected level by level. So, and we are expecting improvements going on. In terms of assessments of the markers, what we do with ANA, we also have a control group. So schools, teachers mark papers, but then we also have an independent body to take sample scripts, because we also need to have a very objective assessment of what is happening in school. So we have appointed a group under the Human Science Research Council to do that evaluation for us as a control group, because ANA mainly it's a diagnostic exercise. So its outcomes are treated differently. Thank you, Speaker.
The Honorable Mnguni. Honorable Mnguni.
Thank you, Honorable Minister. And also, I appreciate the response given to the House and the strides that you have made. Can the Minister then share with the House the experience of the previous diagnostic reports of annual national assessment as presented by the department, and also the lessons that has been learned, and how is that report used to assist the system to improve the system? I thank you.
Honorable Minister.
Speaker, we do annually release your diagnostic report. Is found on our sites, because it's meant also to guide the whole sector as to how we're performing. But as you correctly say, that the ANA assessments, because they are diagnostic tests, they really help us first to be able to group schools and identify which schools need support, which ones don't need our concerted support. For instance, the Gauteng program, which was done by the previous MEC, was informed by ANA, so that she will know which schools need her direct support. But it also helps schools to identify amongst themselves, because it assesses child by child, grade by grade, area by area, to understand if they have to do group teaching, which teacher is good in helping kids, so helping kids write or do certain exercises. So it helps schools also to develop their own school improvement plans, but it helps the district to do school improvement plans, but it also educates our educators about the different competencies required in kids, or skills required level by level, grade by grade. So it really has done a lot in terms of just setting the record, stabilizing the system, and getting us to understand where help is needed, but also understanding what, as I say, what skills are required grade by grade, phase by phase. Speaker, thanks.
The Honorable Macheke.
Thank you, Honorable Speaker. This machine, Honorable Speaker, I'm not sure if it's working properly, because my follow-up question was on question 48, but it's only starting now to flash. So should I continue with my follow-up question? If so, Honorable Speaker, Honorable Minister, the Charity Senior Secondary School in Bloemendal in Port Elizabeth, Eastern Cape, is battling with critical teacher shortages, especially in languages, particularly Afrikaans. And this has been reported 2 years ago. A similar situation is reported just 150 kilometers from Port Elizabeth. The Pierston Primary School, which saw 123 pupils crammed into a single room due to inadequate provision of educators. Question, Honorable Minister, is there a departmental plan to ensure equitable and subject-based supply of educators in the Eastern Cape? If yes, what are the targets and time frame to achieve those targets? I thank you.
Honorable Minister, apparently she meant this for the question 48, but her name came up only now. If Minister is able to answer, please answer. If not, then Madam.
No, I can stand up and try to answer things that I really don't know what the school she's talking about. And then she gives me information to say which one Pearson. So I'm going to be lying about Pearson schools. I don't even know that Pearson school. I think the issue or the question from where I sit is about norms and standards that as nationally we're responsible for. And indeed, there are norms and standards which determine how provinces allocate posts. But if there's a specific problem around a specific school, then it can be brought forward to us, and then we can interact with the province to find out what the problems are. But I'm not able to know problem school by school, problem by problem, and be able to answer on my feet, unless I'm going to be really misleading the House. If the member can give me the name of the school, then I can check what is happening and get back to her.
Okay, thank you very much, Minister. Honorable Mabika.
Thank you. Minister, may I know if you still have confidence that indeed ANA will assist to improve the level of reading and writing and understanding of mathematics in our children? The reason I'm asking this question is because Readathon is still proving that these learners, even though they are involved with ANA, but they still cannot read and write. Thank you.
Honorable Minister.
Speaker, ANA means Annual National Assessments. Assessments don't teach skills, they assess. So what they do, they give us a sense of where the problems are so that we then address them. So ANA will not make a difference if we don't do a difference in teaching. It's an assessment tool. That's what it is.
The Honorable Lovemore.
Thank you, Speaker. Minister, last year you were taken aback at the very low numeracy results, particularly in grade 9. Only 3.4% of grade 9 learners were found to be effectively numerate. You had those results independently verified. The verification showed the real results to be even lower than what your department had determined internally. It showed, in fact, that only 2.1% of grade 9 learners were numerate. But you went with your original score. If you had not, you would have had to admit a decline in what is already an abysmal performance. Minister, why did you ignore the independent verification? And further, will you have independent verification, not moderation of individual papers, verification of the final score carried out on this year's scores?
Honorable Minister.
Speaker, it's an internal assessment. It's in my interest to know what is happening grade, but it's not even for the public. So I don't even need to manipulate any score. What we did, and you're quite right, we were taken aback when we saw the grade 9 results. And that's why this year, for the first time, we're going to be assessing even grade 7 and 8 to really see where the problems are, because that's what ANA is meant to do. In addition to that, I even set up a maths and a rapid team to go and look at the tool we use for grade 9, because indeed I was taken aback by the results, to check whether the tool was a problem, the curriculum was a problem, what were the real issues. And again, that rapid results came to confirm that there was nothing wrong with the tool. The main problem is around teaching in the classrooms. So what have we done? We have prioritized in terms of ICTs, we have prioritized the senior phase, because it's quite clear that some of our biggest problems come in the senior phase. So we've taken steps, and if you want to know what we did with the feedback we got from ANA, then we can tell you all the steps that were there. So the fact that I was taken back, I did make it public to say, indeed, I'm very disappointed that we are performing at this level when kids are supposed to go to the FET phase and begin to choose their subjects. And if they perform at that level, then they won't even choose the subjects we want them to choose at the senior phase. And we are dealing with the issues. And that's what ANA is meant, to give us a feedback as to what is happening in the classrooms so that we can do the necessary interventions. So I don't need to manipulate results, because I need pure information and honest information.
Honorable members, we now go on to question number 68, which has been asked by the Honorable J.L. Mahlangu to the Minister of Arts and Culture.
Thank you.
Honorable Minister.
Thank you, Speaker. My department has been mandated by government to lead and coordinate outcome 14 of 2014-2019 medium strategic framework. And this outcome puts into effect an implementation of Chapter 15 of the National Development Plan, that is transforming society and uniting the country. The work of my department has been organized in line with Chapter 14 of MTSF and in line of Chapter 15 of the NDP. Some of the projects aligned to the NDP are as follows. The establishment of creative industries incubators that will provide tools of production to artists to create local content. The establishment of Mzansi Golden Market, where the goods and services of creative entrepreneurs can be traded with both the public and private sector. Over the next 3 years, the venture capital will be formed to provide the developmental and expansion of capital to creative entrepreneurs. The Department of Arts and Culture has public entities and institutions in the form of museums, theaters, and statutory bodies that exist as implementing arms for the department and report to the department. The relationships between the department and the entities are governed by relevant legislation. The NDP goals that are relevant to the arts, culture, and heritage sector find expression, as we said, in the outcome 14 of MTSF. Some of the areas which emanate and which department is to contribute in line with the NDP are: 1, exhibitions at museums and production of theatrical performances are being encouraged to reflect on our past and celebrate our diversity and working towards uniting the country. 2, the infrastructure program being rolled out at the museums attempts to expand and create an environment that accommodates the diverse multicultural audiences, visitors, to view the exhibitions and plays that showcase the arts, culture, and heritage of our society. 3, renaming places and institutions. That has been one of the vehicles the department has used to ensure that historical moments and heritage is retained and respected. This initiative has been regarded as a unifying symbol. The entities' development programs are geared towards addressing issues of quality education, rural development, and job opportunities. Your excitement will be short-lived. This is done through awarding of bursaries, internships, leaderships, and educational workshops in different fields of arts, culture, and heritage. Rural development has been a priority where exhibitions and plays are brought to communities through touring ventures. Through the infrastructure programs, jobs are created and will continue to be created to address the previously disadvantaged. Funding is done through the department's development projects such as National Arts Council, National Film and Video Foundation, and National Heritage Council to target the
Honorable Minister,
arts,
your time
culture, and
is
heritage.
expired.
Okay, thank you.
Honorable Mahlangu.
Ngiyathokoza manomlomo. Ngithokoza nependulo evela kuNgqongqoshe. Umbuzo wokulandelela ngilo ukuthi njengoba sewuchile ukuthi mningi lembereko eniyenzako esikulimukileko ukuthi ezinye zezinkhungo okhulume ngazo la engeze ezikhulu azitholakali kuwo wonke ama-province. For instance, ku-province engivela kuyo eMpumalanga, eLimpopo, Free State, Northern Cape, azikho. Ingabe kulokho enihlela ukukwenza singakubona kwenabela kulamanye ama-province na? Ngiyathokoza.
Minister, Honorable.
Thank you, Speaker. Honorable Member, thank you for the follow-up question. And yes, as a precursor to the incubators program, we are doing empowerment and development projects for film and music, particularly for musicians and filmmakers who, going forward, will be, together with DTI, joining in giving them grants to ensure that they write the story, South African story of democracy in the past 20 years. And as I said, Honorable Member, this is just the beginning because we are targeting all the provinces. Thank you.
The Honorable Rabutabi.
Thank you, Speaker. Honorable Minister, South African museums are being mismanaged. Robben Island, our most iconic museum, has faced staff strikes, poor quality of service, mismanagement, ferry breakdowns. It is even reportedly struggling to fulfill all the requirements, maintaining their UNESCO World Heritage Site status. This is a disgrace to our heritage, and the museums contribute to achieving NDP goals when they cannot even achieve being functional. So, Honorable Minister, when and how is this mess going to be sorted?
Honorable Minister.
Before you get fixated on the mess you are talking about, firstly, we need to say that the institutions we are referring to, museums and so on, have been around for the past 20 years. And these museums, some of them have been functioning and they continue to function. There are those who are not functioning, and those which are not functioning, as you remember, Honorable Member, we did talk about it even during the time of the budget vote, that we are going to be focusing on those which are not functioning so that we understand what the problem is. If the problem has to do with the personnel, you deal with that. If it's systemic problems, we deal with that. But those things we are raising have been raised before, and they are correct in some instances, and we'll be dealing with them. Thank you.
The Honorable Machobeni.
Thanks, Honorable Minister. The NDP has completely ignored the creative economic industry and all recommendations from the Nairobi Conference of 2008, including INEPAD guidelines. Then the question, why is the Department of Arts and Culture not protecting and regulating this industry? Why are the ministers of this government treating the well-known generation crisis as seriously? Simply because some of these actors involved were the ruling party's election mascots. Surely this crisis symbolizes the cancer of art in South Africa. Finally, why has the department not transformed from black universities to include quality degrees in art, fine art, music, speech, and drama? Why should our children still run to form white university for these skills 20 years down the line? I thank you.
Honorable Minister.
There's no aspect of life which the NDP doesn't talk to. When you talk about arts, culture, and heritage, as we said, that if you go to chapter 15, you will see that that is dedicated to this very sector and this very portfolio. And that will continue. What we are doing now is implementing that which the NDP enjoins us to do, and will continue to do that. You are correct on one thing, that we need to do more in regulating the industry. And this is what has been started by the department, including foregrounding what we need to do by reviewing the white paper on arts and culture And that is continuing and is a process which is going to be finalized. It also touches on the point you are talking about of funding and giving bursaries, particularly in the area of arts, culture, and heritage. And again, that although at a limited scale, those projects are unfolding, and would be happy to share that information. In fact, it's public information. What we would have to do is to accelerate that which has been started. Thank you.
The Honorable Mahlangu. Awusena omunye umbuzo. Siyabonga. We'll now pass to question number 54 that has been asked by the Honorable W.G. James to the Minister of Health. The Honorable Minister of Health.
Thank you, Honorable Speaker. Yes, indeed, Honorable Member, I can confirm to you that all hospitals designated by the Department of Health to treat Ebola virus disease are in a high state of readiness. All designated hospitals have received guidelines on viral hemorrhagic fever and Ebola virus disease, dealing with all aspects of diagnosis, isolation, treatment, and even management of possible fatalities that may occur due to Ebola virus disease and other viral hemorrhagic fevers. These hospitals are Polokwane, Limpopo, Rob Ferreira in Mpumalanga, Charlotte Maxeke and Steve Biko in Gauteng, Addington in KwaZulu-Natal, Klerksdorp in Northwest, Pilinomi in Free State, Kimberley in Northern Cape, Freya Hospital in East London and Livingston Hospital in Port Elizabeth, both of them in the Eastern Cape, and Tygerberg Hospital in the Western Cape. Each of these hospitals have been supplied with a full complement of personal protective equipment, which we call PPE. That consists of a jumpsuit, scrub suit, N95 mask, shoe cover, double gloves, and even goggles. There are 50 sets of this protective clothing in each of the hospitals, except Charlotte Maxeke and Steve Biko, which have been given a complement of 100 each, and Freya and Livingston Hospital, which have been given a complement of 30 each. What it means, Honorable Member, is that, for instance, if there is any Ebola in Charlotte Maxeke Hospital, 100 health workers will be ready to jump into action in a full complement of personal protective clothing. Honorable Member, we are not only ready here at home, we are actually physically present in West African states of Guinea, Sierra Leone, and Liberia. We have dispatched a team of highly trained specialists who have been there for the past 2 weeks. They have left this country with a mobile laboratory, which is based in Sierra Leone and is helping to diagnose the disease throughout the region. That's why, Honorable Member, this morning, if you read today's Cape Times, the headlines on today's Cape Times, the subheading says MSF, meaning Doctors Without Borders, Lord South Africa, while slamming world response to epidemic in Africa. It's because of our presence there and that we have been there for the past 2 weeks helping. Within SADC, the state of readiness is also very much revolves on the expertise we have here in South Africa. All the laboratory diagnosis of Ebola within SADC will only be performed at the National Institute for Communicable Disease here in South Africa. The National Institute of Communicable Disease has been declared a center of excellence for Ebola management within SADC by a resolution of SADC Ministers of Health when they met for Ebola preparedness in Johannesburg recently. This resolution of health ministers was ratified by SADC heads of states when they met at Victoria Falls last week. So yes, Honorable Member, we are very much ready. In addition, the BSL-4, or what is called Biosafety Laboratory Level 4, in the whole continent of Africa is only found here in South Africa, at Sandringham, in the whole continent. It can deal with some of the worst and most deadly organisms like Ebola, smallpox when it was still there, anthrax, we can deal with that, and that's why we are ready. On what I've said, I've never yet mentioned the readiness of the South African Military Health Services. If there is time or if there's a need, I can also tell you exactly what they've got. So we are very satisfied about our state of readiness. Thank you.
The Honorable James.
Minister, thank you very much for your answer to the question. Minister, you're on the record, a record you've now confirmed in this House, saying that we are ready to deal with Ebola. But we know, after visiting 9 of the 11 hospitals, and I thought you should also know by now, that 3 of those 11 hospitals you designated are not ready to deal with Ebola because they lack decontamination rooms. There are no decontamination rooms for health workers. Would the minister therefore confirm that his statement before and today is both premature and wrong? And would he therefore assure the House that he will do whatever is necessary to help the hospitals meet the exacting technical standards to deal with a diabolical virus like Ebola?
The Honorable the Minister.
Honorable Speaker, I stood here to say I'm confirming our state of readiness. And I'm still confirming it, that we are ready to deal with Ebola. If Mr. James believes there is something more that is needed, as he's saying, every week, there's a meeting of multi-sectoral national outbreak response team, in which all the expertise and experts sit. I'm not one of the experts. I don't know whether Mr. James is. I'm not one of the experts. They sit there every week. Every province have got the provincial outbreak response teams. They discuss this state of readiness and what is missing and what is not. And they ask the experts whether that is necessary to be there. And so I'm standing up again to say we are ready to deal with Ebola in this country. If there is anything missing, give it to me. I'll take it to the multi-break response teams. The experts will tell us whether that is needed or not.
The Honorable Nkomo.
Thank you very much, Speaker. To the Minister, our borders are very porous. How is the department and the South African National Defence Force, including other monitoring agencies, equipped to deal with the potential health threats that could come through these means, especially because the focus is mostly at obvious points of entry, like airports? The second issue is that without sensationalizing the issue and scaring the public, has there been adequate education of the general public on the Ebola virus and how it is transmitted, as well as what to look for and where people need to report possible cases? Has any of this been used, this education, in pamphlets, through television or radio? Thank you.
The Honorable Minister.
Thank you, Honorable Speaker. This issue of porous borders is always mentioned in almost every meeting and even by the press. The team that sits every week, the multi-response team that sits every week, assesses the problems, and according to them, they looked at areas where there are likely to be problems. And they say the problems are likely to occur at OR Tambo International Airport. And that is why Charlotte McCrack and Steve Biko have been given 100 protective clothing equipment, because we believe if there's going to be any Ebola in South Africa, it will come through there. The other area is Lanseria Airport in Johannesburg. We are now looking at Cape International Airport and Kinshasa in Durban. The issue that we mentioned around porous borders we keep on asking ourselves if you understand Ebola. Who is going to drive from Liberia or Guinea and Sierra Leone and come here to South Africa via our borders? Because we keep on being told we must close Bait Bridge border post. We are checking there, but we don't think that is the route through which there will be problems, unless our experts have gone very wrong. But I am repeating again, because we are assessing almost every day what is happening, we believe we are very ready. There's another thing which I want to tell honorable members here. In Sierra Leone and Guinea and Liberia, people don't just easily move out of that area. In the place where Ebola is, the president have cordoned off that area, the president of the 3 countries, they've cordoned off that area. People are not allowed freely to move in and out of that area because they want to contain it. If you go there, you will find soldiers around in that area. And if people have to fly, the World Health Organization is there to screen them first. When we screen them here, you must understand the second screening. They are actually screened even from their country of origin. So that is why I keep on repeating that we are very ready. The issue of adequate education, honorable member, we have tried our best. We have tried our best. We have issued guidelines because you are asking, where will people go if they suspect they've got Ebola? Every single hospital in the country, not only these ones which are ready, every single hospital, we have issued them with the guidelines. Every single doctor, even doctors in private practice, have been issued with the guideline. The patient from Liberia who works in the mine, who was reported all over the press as being suspected of having Ebola, was referred to the NICD by a private doctor. Because when he went there with fever, the private doctor took our guidelines and read from our guidelines and phoned the NICD and kept on being guided. There's a toll-free line between all healthcare facilities with patients. It will be difficult for us to give each and every South African that guideline because we believe whenever they get problems, they will either go to the clinic or a hospital or their private doctor. When they arrive there, they'll find these guidelines waiting for them.
Honorable Minister, your time. The Honorable Sheikh Imam. Honorable Sheikh Imam. Sheikh usaphumile.
Thank you, Honorable Speaker. To the Honorable Minister of Health, my question is that we've been told that 11 hospitals in South Africa are fully ready if we do have an outbreak of Ebola. But on the day of the briefing in Johannesburg, I brought to your attention, Honorable Minister, the problems at the border, and I was given an assurance that we have full border control and there is no such problem. But to my surprise, an hour later when I went to my hotel room, Honorable Minister, it was Sky News on, and there I saw them actually cutting the fence and coming through the border. Again, the question is, how can we secure these borders? Thank you.
Of course, he's not the Honorable Minister that controls the borders. He deals with health issues.
Yes.
But you are free, Honorable Minister, to answer.
Yes, I wish to answer it, Chairperson. We have never said now that there is Ebola. The Department of Health, as Honorable Speaker, is going to be responsible for securing borders of South Africa. It's not our responsibility to do that. And at any rate, I've already told you, we are assessing areas through which Ebola is likely to come. If somebody cuts that border and comes in, do you think that person is a sick person with Ebola from Liberia, walking all the way from Liberia to come in? Please be realistic, man. Please. I don't think you are being very fair. Let's be very practical and realistic. How will Ebola come into South Africa? The Ebola patients are very sick to be traveling and cutting wires here through the borders. That's not going to happen. Thank you.
Honorable members, we now move to question number 96, which has been asked by the Honorable Mashabela to the Minister of Basic Education, the busiest minister.
Speaker, sorry, a point of order here.
Yes.
Speaker, we only had 3 follow-up questions to the Honourable James's question, and I believe there was another member that wanted to ask a supplementary.
No, if there's any more, there would be only one. Can I take Honorable Mukoto? No, the reason I didn't take it was because where's the... Yes, I'm coming. I'm now calling Mukoto, Honorable Mukoto, for a follow-up.
Thank you, Honorable Speaker. I wish to thank the Minister of Health with the assurance that he has given us. But further, I would like to bring to his attention that in provinces like the Northwest, we have got a lot of border gates that needs to be also taken into consideration we need to be aware of the inflow that is taking place through those border posts, Honorable Minister. Thank you.
Honorable Minister.
You know, Honorable Speaker, the DA is praying every day that we get Ebola in this country. And it's not happening.
Point of order.
Not happening, they are so disappointed.
Point of order.
Why
yes, Honorable,
are you praying that
Honorable
the
Chief,
must get
Honorable
Ebola?
Minister, can you give me a chance to allow the point of order? Honorable Chief Whip.
Madam Speaker, I would ask that you rule whether it's parliamentary for the Minister to say that members of this House are praying every day for sickness to be visited on people of South Africa.
No, most definitely not. Honorable Minister, you can't cast aspersions on members of the House that they are praying for Ebola.
Honorable Speaker, the first person who issued a false statement was a member of DA.
No, yes. Honorable Minister, okay. Please just withdraw that.
Okay, Honorable Speaker, I withdraw.
All right.
But largely, I withdraw, Honorable Speaker.
Okay, then answer if you want to answer.
In answering this question, Honorable Speaker, I've already said it, maybe I'm just repeating, about the issue of borders, about the fact that SADC ministers have met and discussed this issue. On Friday, I'll be in Victoria Falls, where the chairperson of SADC ministers have called us again, because the chairperson is now the Minister of Health in Zimbabwe. Our officials are meeting tomorrow in Victoria Falls. We meet on Friday. We discuss the whole issue of SADC. And I said I can confirm, even after sustaining here, that nobody, not only in South Africa, within the whole SADC, has been diagnosed with Ebola. Why am I so sure? Because if there is going to be any, I'm talking about laboratory diagnosis, if it's going to be any laboratory diagnosis in any of the 15 SADC member states, it will be known by us first here, because it can only be done at Sandringham in Johannesburg. There's no other laboratory. That's why I can stand up and say so confidently. Thank you.
Honourable members, can I go back to question number 96 that has been asked by the Honourable Mashabela to the Minister of Basic Education. Honourable Minister.
No, thank you, Speaker. Speaker, in terms of insourcing printing material, the department has indeed considered some insourcing, but of some materials with very small titles and run, like your African languages books, which are not very attractive to the private sector. But big runs like your Rainbow series, your Siavula and Shuttleworth, which go to about 54 million workbooks a year, sent to 24,000 schools. In total, it just is billions of pages that I don't think the sector should even consider doing it. So there's no thought of the big runs, like the workbooks. In terms of the cost involved, we already have cut lots of costs around this process, because even the Rainbow, when we went to the market, it was about 54 rands per book. We had our own writers who will be writing in any case for the publishers. We were able to reduce the price to 11 rands per book. Your Shuttleworth books, because open source, again, we made lots of savings. A book would normally cost us about 300 rands per book, but because it's open source and it's your best material, we're paying something like 33 rands. So we've cut lots of, we've been able to make lots of savings, Chair, through these methods, and we're not thinking of insourcing because it's not necessary. In terms of the grade R and curriculum, we're working in social development. We have done the curriculum for your grade R. In terms of being ready with the practitioners next year, for the year 2014, 2015, 2016, we will indeed have trained practitioners to deal with your grade R and ECDs, because we've been working on these things for a long time, so it's not like it's a new program. So it's a program which had long started, and we will be able to have all the numbers that we have indicated in the State of the Nation address. Thank you very much, Chair.
The Honorable Mashabela.
Thank you. I think the Honorable Minister will be able to know something now, because she failed to answer my question before. Honorable Minister, on the subject on ECD practitioners, given the high levels of blockage in the process of hiring teachers, particularly in the Eastern Cape, can the Honorable Minister explain how the hiring of ECD practitioners to meet the DD of 2015 to 16 shall escape this red tape and bureaucracy? Thank you.
Chair, let me read the member her question so that we just understand who's understanding what. The question reads, has she considered all short and long-term implications, both financial and otherwise, for insourcing? So I don't know which question has not been answered, because I've answered that question adequately. Insourcing of the printing and distribution of learners' workbooks. That was the question, and that's what I was asking. The Eastern Cape story comes as an afterthought. It was the next question, whether the targeted 13,000 trained ECD practitioners will be achieved for the 2015 financial. There were no stories about red tape, so she's just bringing afterthought. So I've answered the question. Unless she wants to ask a follow-up or not on the question, she must follow up on this question. She can't bring a question and say, I have not answered the question, because that's what she's saying. She says I have to learn something, because I've not answered her questions. So I'm telling her that I've answered the question.
Okay. Honorable Lovemore. Oh, okay.
Deputy Speaker. Minister, you are well aware that your government's own report last year found that grade R is not adding real value to our learners. There is close to no correlation between having attended a year of grade R and being ready to succeed in grade 1. It is time, Minister, that you implemented a school readiness test, both to safeguard learners against failure in their foundation phase and to test grade R efficacy on an ongoing basis. Minister, when will you implement such a school readiness test?
When we have developed a tool to do it, we'll do it. We have not developed that tool, we're not doing it.
Thank you, honorable members. Members, we move to question 74. Honorable members, sorry. All right, it appears like I was in too much of a hurry. Honorable Mponjane?
Thank you, Deputy Speaker, Honourable Minister. The system is producing learners who cannot read nor write. The failure rate at universities is very high. And the research, which was commissioned by the Department of Higher Education, just yesterday published its findings. One of the things it says is that only 10% of the South African schools produce university material students. This can be attributed to what happens at the foundation phase, where teachers at that phase are not professionally qualified, their salaries are not standardized. In fact, the highest salary for those teachers is about 2,000 and not standardized. The learning environments are very, 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 very poor.
Honorable Mponjane, your preamble has taken your time.
How are you going to bring those teachers up to the standard and also the infrastructure at that level for conducive quality education?
Minister.
Chair, thank you very much again for the question from the member. As the member indicates, it's information that is drawn, that is provided by us from government when we are assessing the system so that we know what we need to do. And because we have that information you are reading to us, came from us, that's the information which is guiding us on what to do. So we are indeed training teachers with social development, with higher institutions. We are working with provinces to standardize the salaries. And if you are aware, in our infrastructure plans, there is also a rollout plan on ECD centers. So all the things we're saying, I thought in the report that tells you what the problems will have told you what the solutions are, because the solutions are also in the same report.
Thank you, Minister. Honorable Kubisa, NFP.
Thank you, Deputy Speaker. Honorable Minister, may I know what qualification must an educator have in order to teach schools, in a grade R school? And then, secondly, how long does that qualification take? And finally, there is a general outcry with regard to MECA salaries that are paid to grade R educators. What has the department done to ensure that grade R educators are well paid?
Chair, it varies because some of the teachers who are in the grade R will have been qualified teachers, some of them in excess, then we train them to just deal with that phase. But the minimum requirement is your NQ level 4, and that's what we're building from. In terms of salaries, it is indeed, it has been a perennial problem, the question of salaries. And that's why for the first step, we have gotten provinces to equalize the plan, because in terms of the qualifications for them to be fully qualified teachers, at that level, they're not necessarily fully qualified teachers. So we're training them to a level where they can, in terms of your norms and standards for qualified teachers, they can be, and then start absorbing them into the system. So there is a plan to absorb them as they qualify. But because some of them are not necessarily qualified to be, they're qualified to teach those learners, but they will not qualify for the salaries that I think they're looking at. But it's something that we're working on with unions, with teachers and provinces. But it is, the first step has been to equalize along different provinces.
Thank you, Minister. Members, we've exhausted the supplementary questions. Regarding question number 4, which we were supposed to move to, posed to the Minister of Water and Sanitation, I'm advised that neither the Minister nor the Deputy is available. We received apologies. Minister is abroad. I was then advised that the Minister of Human Settlement is available to take questions, but will not be able to respond to supplementary questions. It's our view that the House will best be served when members of the executive are able to take supplementary questions as well. So I would like to urge members of the executive to please make appropriate prior arrangements for questions posed to them. Questions for oral reply are one vital tool used by members to hold the executive accountable. The question, therefore, will stand over. Honorable members.
Deputy Speaker.
Yes, Honorable Member.
Deputy Speaker, may I request you to establish or inform the House where the Deputy Minister is?
You want me to ask the House where he is?
No, the general rule is that when the Minister is not available, the Deputy Minister stands in. If neither of them are available, then another minister from the executive generally answers the question.
No, but I have just read to you a statement in which we are saying that both are not here. The minister who was given the responsibility to do so feels she's unable to take the supplementary questions. And this is why we feel that it should not go ahead.
Sorry, unless I misheard, Deputy Speaker, and I'm not trying to be difficult here, you indicated to us that the minister was abroad. There was no indication of where the Deputy Minister was.
Yes, he's not available. Honorable members, I think you're out of order. Now, let me tell you why I'm saying you're out of order. I'm giving an explanation. You are throwing stuff at me. I'm here. I'm here. So if you have an objection, you can put in an objection. I have taken a decision that that thing will stand over. The minister had offered to respond, but because she's not the minister responsible, she's not able to take the supplementary questions because that's not her area.
Deputy Speaker, I'm really not meaning to disrespect you in any way, and I'm not throwing anything at you. What I am asking is that when ministers or deputy ministers are not able to come to this House for them to be held account, bearing in mind this cluster was last year in September last year. We're now going to have to wait until the next cluster, until they return, unless there's the member requests that they get put onto the next order paper for ministerial questions. And I think it's only courteous for them to provide this House with a reason for their absence.
Honourable Minister.
Thank you very much, Deputy Speaker. The Deputy Minister, unfortunately, is not well and has been requested to take a rest by the doctors, so she is off sick. She is not here because she doesn't want to be here, but she is not well.
Okay. Thank you, Honourable Minister. Members, we'll proceed to question number 58. Asked by Ms. L.L. van der Merwe to the Minister of Social Development. Honourable Minister.
Ngiyabonga Sekela Somlomo. We have declared this year the year of people with disabilities. The transfer of the disability function to the department provides us with an opportunity to address this issue, which was highlighted during the national dialogue held with the disability sector. To date, there are 590 children with disabilities out of 137 residential care facilities who are not attending school. In addition, there are 6,654 children out of 236 daycare centers who are not receiving formal education, but are in daycare centers for stimulation. They can't go to school. They are severely disabled. The following plans are in place to integrate these learners into the education system. We have finalized the comprehensive program on early childhood development, which includes the first 1,000 days of the child. This campaign will, amongst others, assist us to detect any disability at an early stage for proper early intervention and support. Furthermore, the universalization of ECD as directed by the 2012 ANC conference will complement this approach. I have appointed a team consisting of representatives of the disability sector and the department to develop a program of action with clear implementable strategies to address issues raised by the sector during the dialogue immediately after the budget vote. And I want to assure the honorable member that this question will receive the utmost attention. Thank you.
Thank you, Honorable Minister. Honorable van der Merwe.
Thank you very much, Deputy Speaker, and thank you very much, Honourable Minister, for your answer. I think the 100-something you cited is a far cry from a report which I saw that stated that almost 500,000 students are not, or learners are not accessing education. But I think we both agree that one learner with a disability not accessing education is one too many. And then during a recent visit, for example, to Ward 1 in Ngutu, the IFP found 4 learners in a closed vicinity not accessing education. And while this is only one ward, in many communities the right to education for children living with disabilities exists largely on paper, Honourable Minister. And therefore my question to you is, how will you deal with the challenges that these children face, such as high levels of discrimination due to the negative attitudes of their parents, teachers and communities, the many failures of the mainstream education system that simply doesn't cater for learners with disabilities? And can you give us the undertaking today, Honourable Minister, that you will rectify the many failures of the now defunct Department of Women, Children and People with Disabilities? I thank you.
Honourable Minister.
Ngiyabonga sekela somlomo uGeorge ukuthi akulona ulimi lwami kodwa angazi ukuthi i-defunct i-Department of Women ngazi ukuthi kwaba nomthetho wokufaka omunye umsebenzi kwa social development omunye waba kwa women. Emva kwe budget vote saxoxisana mayelana ne support ezemfundo, ezemsebenzi, ezomthetho nezomthetho eziphathelene nenhlangano yamazwe onke kanye nokuthi ama department nama agency ne private sector benza kanjani ukuthi babhekele izinto zabantu abakhubazekile kanye nazo inhlangano lezi ezilana ngoba ezinye ziyakhuluma kodwa nazo ayinabo abantu abakhubazekile. So lokhu kufanele ukuthi kube umsebenzi wethu sonke nathi futhi njenge department njengoba si busy si mobilize imphakathi siyahlangana nabantwana abakhubazekile. Kodwa futhi ngiyafuna ukusho ukuthi ngonyaka odlule kwakade ku iprogram kamongameli sisempumalanga kukhona isikole esazivakashela eku-integratewe khona abantwana abakhubazekile nabangakhubazekanga. So akulona iqiniso ukuthi umnyango wezemfundo uyahluleka uyasebenza ukuthi nje sisonke sila indaba yabantu abakhubazekile isasidida. So nathi sizokwenza ukuthi sifake igxatha ukuthi abantu abakhubazekile babhekeleleke ngendlela efanelekile. Ngiyabonga.
Thank you. Honorable Mukoto. Okay. Honorable Magzin, sorry.
Thank you, Deputy Speaker. Mphathiswa wezenhlalakahle. How many schools do we have for learners with disability in South Africa? Why does these schools in white areas enjoy state-of-the-art facilities when black schools of the same nature are still under-resourced? Why there is no transformation regarding black disability in the sector of schooling? Because to be disabled and black remain a death sentence and a nightmare in South Africa. Why is the disability schooling system not linked to any viable exit mechanism like further education and training opportunities, skill development and employment? Why do we train these students up to a certain ceiling and then send them home to be locked away and hidden away from the public domain. Thank you.
Honorable Minister.
Sekela somlomo. Imbuzo eminingi la, imbuzo emisha. Iyofakwa ngokulandelayo ngiyiphendule. Kodwa akulona iqiniso ukuthi abantu abaya ezikoleni zabantu abakhubazekile bayafihlwa. Ngoba su social development khona abantu abama graduate esibaqashile abakhubazekile. Eastern Cape une quota yawo wonke ama department, and proudly ka social development siyayimitha leyo quota. And namapati nawo fanele azenzele ukuthi abe ne quota eze nabantu abakhubazekile. Singayenzi i-lip service, because i-lip service iyalahlisana sometimes. But angifuni ukuthi lolu daba silwenze udaba lokudlala, because ludaba all serious, and siyathanda ukuthi imphakathi ibhekele indaba yabantu abakhubazekile. And enye into eye transformation ezikoleni iyiqiniso, more particularly abantwana abane autism, izikole zabo zihlale igcwele ngaso sonke isikhathi, ziyabiza. Umnyango usabheka futhi leyo ndaba ukuthi singenza kanjani ukuthi abantwana abane autism bakwazi ukuthi ba accommodatewe ezikoleni zabantwana abakhubazekile. Ngiyabonga.
Honorable SP Kopani.
Thank you, Deputy Speaker. Disability is a human right and is a developmental issue. A public service and administration report confirmed that 80% of teachers in schools for the deaf are unable to use the sign language, and 80% in school for the blinds. They lack appropriate skills, including the braille. Now, my question is to you, Honorable Minister. How many schools have you visited yourself to establish the specific needs of those disabled children? And what is it that you are going to do to make sure that the Minister of Basic Education cater for those basic infrastructure that are lacking to the all schools? Thank you.
Honorable Minister.
Nako-ke futhi uGeorge uyangidida ngoba mina ngazi ukuthi i-disability is a human right. So anguzwa kahle lo mbuzo. Yeah, yes. But okwesibili izikole siyayivakashela zabantu abakhubazekile. Zifola under basic education izikole zabantu abakhubazekile. But all in all, siyayivakashela izikole zabantu abakhubazekile. And ukuba benifuna umbuzo na ubhala phansi nifuna ukuthi zingaki izikole zabantu abakhubazekile, ngabe ngikubhalile lokho, ngabe nginikutholile, asikho izathu sokuthi ngihambe ngiyofihla umbuzo enufunayo. But njengoba uMinister we-Education eshilo, lezi zinto lezi ezikhulunywayo about developmental issues and issues of disability, it is issues that are raised in our reports. And ekhombisayo ukuthi siyimisele ukwenza isiqiniseko sokuthi indaba zabantu abakhubazekile ithatheleka phezulu. And the fact that ngonyaka odlule saba ne-summit nabantu with autism and their parents, saba ne-engagement nabantwana abane-albinism youth. Now this year emva kwe-budget vote saba ne-dialogue nabantu abakhubazekile. Kusho kona ukuthi sifuna ukuqhubekela phambili. Ake nisinikeni isikhathi nizobona emva kwesikhathi umsebenzi esizobe sesiwenzile. Siyabonga.
Speaker.
Yes, sir.
The Minister just said to us that she doesn't understand the question. Could we repeat the question to her? Perhaps
No,
she'll
Honourable
understand it
Member. No, Honourable Member.
She
No,
didn't answer the question on sign language. She doesn't understand the question on sign language, Speaker.
Honorable member, take your seat. Okay. Honorable members, Honorable Kubisa.
Deputy Speaker, I wanted to ask about the partnership that exists between the department and the Department of Basic Education, because we only find that even if when these learners are at school, they do not get the orthopedagogic assistance that's supposed to get. I understand as a department, you also make a follow-up. You take care of the history of the learner, and you also make a follow-up even when that learner is in a school. Thank you, Honorable Speaker.
Honorable Minister. Honorable Minister.
Izofika ninwene yakhe inkomfa. Yebo, sekela somlomo siyasebenzisana kakhulu ne Department ye Basic Education njengokuthi ama assistive devices ithina nezempilo eswa providayo kanye ne counseling ithina esi providayo kanye ne grant ithina esi providayo nazo zonke izinto. So kune relationship between the Department of Basic Education, the Department of Health, and Social Development. Kulolu daba. Ngiyabonga.
Minister, do you want to say anything on the sign language story? The sign language question. Okay. All right. Okay. We'll go to the next one. Honorable members, we've done with the supplementary questions. Is there anyone else who I'm missing? Okay, there's none. We're going to the next question, and it's to the Minister of Social Development from Ms. VP Mokgotsi. Honorable VP Mokgotsi.
Thank you, Deputy Speaker. When the South African Social Security Agency was formed in 2006, it was mandated to pay and administer social grants in South Africa. However, since its formation, the agency has only been able to administer the grants, but the function of payment was given to external service providers. In April 2012, a new tender was awarded, and we declared that it would be the last time this function would be given to external service providers. We set ourselves a 5-year period to prepare for the takeover of this function, and a ministerial advisory committee was formed to assist the department and SASSA to develop a detailed business plan and a roadmap that will ensure that government builds its own capacity to pay social grants. Chairperson, the department is monitoring and implementing the North Gauteng High Court order, and quarterly reports are received from all 9 provinces. With regard to foster care, I cannot stand here and proclaim that all is well with our foster children, because through outreach programs and Project Mikonzo, we have seen that we have greater challenges when it comes to foster care generally. The children in foster homes have told us horrendous stories, stories of abuse and neglect, stories of being treated differently by their foster parents, concerns about the misuse of the foster child grant by foster parents, and some have even died in the care of foster parents as a result of neglect. In some cases, we have even removed children whom we have found to be neglected or abused by their foster parents as mandated by the Children's Act. A silent narration of the story of Annen Boysen is that she was a foster child. We cannot continue to ignore the voices of our children, and I've instructed the department and SASSA to address the immediate challenges faced by the children in foster care. I have taken a decision to establish a committee that will investigate the state of foster care in the country. The committee is expected to start in November and report after or in 18 months. With regards to the investigation that the honorable member is referring to, I want to inform this House that the team comprising of the Department of Social Development and Black Sash and other NGOs from various provinces has concluded its work, and I will make the report and recommendations of the team on this matter public next week.
Okay.
Thank you.
Thank you, Honorable Minister. Honorable Mokgotsi.
Thank you, Minister. We as the ANC would like to say thank you and Raleboga with the Minister and the Ministerial Committee on the progress that you have made, especially on the SASSA tender. But Minister, the question one have is on the foster care grant. After the North Court ruling, how many families has benefited in terms of the foster care grant? Minister, on the airtime scam, we will wait for the report and thank you.
Minister.
Deputy Speaker, many families, almost all of them, are still benefiting, but the program is with the reviews, because every 2 years there must be a review. And that is why we were taken to court. And the court said we must not cut the foster child grant, but we think there are still challenges in as far as the foster child grant. But also, Deputy Speaker, I must say that generally, as the Department of Social Development, we are unhappy about how South Africans treat children generally, not foster care children only. The issues of hijacking cars with children and not even save those children say that we don't have respect for our children. And again, this matter needs the whole of the South African society. Thank you.
Thank you. Honorable van der Merwe.
Thank you very much, Deputy Speaker. Honourable Minister, there are allegations that millions in public money meant for poor orphans was blown in suspect deals with a politically connected company. Have you or will you launch an investigation into this? Thank you.
Honorable Minister.
May I ask the honorable member to repeat the question and be open so that I can be able to respond?
Honorable van der Merwe.
Thank you, Deputy Speaker. I'm asking the Minister that there are allegations that SASSA has spent millions in public money meant for poor orphans on suspect deals with politically connected companies. It's been in the media, and I know that you might not want to respond to media articles, but I'm simply asking whether you are planning to launch an investigation into this matter. Thank you.
Okay. Issues that have been in the media about the security company, are you talking about that? Yes, there is an investigation, and the public protector is also busy with the matter. And I've requested the concerned official to write a report to that effect. Yes.
Honorable Maxon.
Thank you, Deputy Speaker. Honorable Minister, who is the service provider regarding SASSA services? Speaking about good governance, why do social services officials continue to harass its client? The point in case is an incident in Ekurhuleni where Mrs. Beatrice Malungane was harassed and beaten by SASSA officials and was subsequently hospitalized for 2 weeks. This incident took place in June 2012. For interest's sake, what action has your department has taken against these officials? SASSA recorded 1,848 cases of fraud in its system, worth about 4.5 million. Furthermore, Cash Paymaster Service, after a long costly court battle, now profits heavily on the 15 million government grants every month. Is this just a way for comrades to loot rather than help the poor of the poorest?
Honorable Minister.
Deputy Speaker, Honorable Member Maxine, uthatha question 99, uzofaka la. Ngoba le question ayifakayo la, si prepare la ikhona. Cha, angikwazi ukuyiphendula manje ngoba uyibuzile futhi. Kodwa futhi okwesibili uma ngabe honorable member efuna i-report about i-action esithathile ngama case we corruption akomithwa ama officials ka social development singayiletha futhi leyo report kodwa ibingekho la i-question esho lokho and yeah so singayiletha report asina i-problem yokuletha report.
Yes, honorable member.
Ngishilo lapha kumbuzo wokuqala sekela somlomo ukuthi ngezinto ezenziwa i-CPS sizo report ngesonto elizayo siyenzile investigation sine full report siyenze kanye nama NGO sangayenza sodwa ngoba ke thina kusho ukuthi sisebenzisana nabo labantu ama NGO azobe khona si presenta i-report ne action esizoyithatha emva kwaleyo report futhi le action sobe singayithathi sodwa si social development sobe samsana nawo ama NGO siyabonga.
Okay. Honorable member. No, I've got a time. No. The answers you've been given that. Honorable Kupani, yes. No, this is not. No, it's so failing. It's so fake.
Minister, last year, November, the Constitutional Court provided a damning judgment on the awarding of SASSA tender to Cash Payment Service and declared the tender process constitutionally invalid. And the court also determined that the SASSA CEO, Virginia Peterson, failed to ensure the due diligence during the tender awarding process, and that constitutional and the legislative requirements were not met. Grants provide financial relief to South African people, about 50 million of them. Now, my question is to you, Minister. When will you hold the CEO accountable for this debacle and fire her?
Honorable Minister.
Indaba eyayibangwa kakhulu lapho ukuthi itender yayi ne corruption and i-court yathi ibingekho i-corruption. Number one. Okwesibili, i-court yathi asiqale phansi i-process yetender. Njengamanje silandela leyo mqathango yase-court ngokuphelele. Akukho kunye sokwenza eceleni. and Tina si reporter e court. Siyabonga.
Thank you, Honorable Minister. The time allocated for questions has expired. Yeah? There's still a question? How many minutes are left there? Oh. Where is the, which question is that? Which question is that? 70. Yeah? Is this one?
Yes, let me see that one.
Yeah, it's 70. Yeah, yeah.
And then we move to this one.
Oh, okay. All right. All right. All right. All right. Honorable members, hold on. Let's proceed to the question 70. It's question asked of the Minister of Sports and Recreation. Razmataz.
Thank you, Chair. No, the governance and level of transformation in the bigger sport federations have not been adequate up to now. The pilot audit on transformation of the Big Five federations in 2013 revealed that the level and rate of transformation has been poorer than expected. Governance is an important part of the transformation charter and scorecard. Progress in this dimension of transformation is monitored annually, and targets of selected components of governance have been set. In 2014, 16 federations will report on the status of transformation from national to provincial and school level. Thank you.
Thank you. Honorable Musi.
Ke a leboga motlatsa motlotlegi Musa Khotla. Minister, a seo o se rayang se kaya gore morago ga diphetogo le ditshepiso tseo di tlile go akaretsa batho botlhe le go aga mabala a metshameko e etsa rugby le cricket mo metsemagaeng le metsesetoropo e akaretsang magae ao pele a neng a ikgatolositswe ke puso ya tlhaolele a akaretsa bokudungkgwane ko bo Northwest bo Bonabona bo Mpuluzi ko Mpumalanga bo Qoqodala ko Lady Frere. Ke a leboga motlatsa Musa Khotla.
Ke a leboga ra a kitse ka Setswana nka re honorable ke eng. Motlhompheng ke a leboga motlhompheng ke leboga o menagane motlotleng ape a re a kwa re mangope mo borra ne ke re ke tlhalosela seo ne ke tlhalosela gore re tla kgona gore mmereko e re o dirang go tlisa ditlhabololo mo tsa metshameko ro ise ko metseng ko magaeng re tlise tlhabololo ka gore re age dibaka tsa metshameko gotlhelele mo Afrika Borwa seo re ikanne gore re tlile go se dira ka bojotlhenyana bo re na le mbona bo re bo neilweng ya ka re tlhalositse nakong yeo re ne re tlhalosa tsa semadi a re wa neilweng ke lefapha la puso la Minister of Finance gore re tlile go berekela thata ko di rural area kana ko magaeng gore itlhelle ko ka ntlha ya gore re ka se bui ka tlhabololo ya tsa metshameko le transformation re sa bui ka tlhabololo e simollang ko fatshe ko dibakeng tsa moo batho ba leng gore ba dikobo tse di magetleng ba ba ratang go raloka rugby kana any other sport a ba kgone gore ba nne le dibaka tsa go tshamekela yaanong ke mmereko wa rona ya ka re tlhalositse gore re berekela gore re itlhelle ko bathong ba rona gore le bona ba kgone go tokatsa maphelo a bona ka go tshameka metshameko e ba e ratang e le tota. Ke a leboga.
Honorable Malachi.
Thank you, Speaker. Minister, your department has set targets for initiatives that enhance sports participation and drive transformation in sports. But the program that drives this, being the mass participation program, which accounts for over 55% of the current budget, is failing to achieve this. According to information from the Auditor General in line of the financial statement of the department, for 2 years running, it has missed its targets. It met only 20% of the targeted number of participants in sports promotion projects. It met only less than 50% of targeted sustainable and active recreational events. In light of all of this, what will the minister do to take action that will ensure that the monies allocated to the mass participation program to widen access to sports participation justifies the monies allocated to this, and when will he do so, and whether there will be action taken against officials for the underperformance of this program, which is key for driving transformation in sports?
Honorable Minister.
We are going to ensure that the money that is allocated, funds allocated for mass participation, are actually exhausted, and we utilize those funds for that particular purpose. And in this particular instance, that program we're going to kickstart now for implementation, working with the provinces through the conditional grant that the honorable member has actually referred to. And I think it is absolutely possible to reach the targets that we have set for ourselves. Thank you.
Honorable Stode of the IFP.
Thank you, Deputy Speaker. I don't think the minister wants to be remembered as a bunch of losers, as a minister of bunch of losers, because okwenza ukuthi ngisho kanjena ukuthi ama-ministers zonke owalandelayo akhuluma ukuthi kuzoba ne-transformation ku-sports. Kuze kube manje uminister okhona ukhuluma nge-transformation esiyibone ngenayo imphumela. Umbuzo ukuthi uma i-transformation ingenzeki ku-national, abantu abasemakhaya ku-rural areas izokwazi ukufika kubo emadolobheni ingakwazi ukufika. Ngiyathokoza.
Honorable Minister.
Thank you, Chairperson, Deputy Speaker. I just want to explain to the honorable member, if you follow what we're doing in terms of Department of Sports and the ministry, not only through half-baked reports in the newspapers, you will realize that first, we tabled a full report on the baseline report that we have conducted on transformation, starting with the 5 top priority codes in South Africa. And that is being rolled out to the 16 plus codes in terms of the baseline research report. And secondly, we are meeting now with all the first 5 top priority codes to get a response from them in terms of transformation and how they are going to meet the targets. Up until now, I've already met 3 of the top 3, including rugby, cricket, and football. And then I'm also going to meet, among others, with athletics and netball. And that is what is important. So, honorable member, I can assure you that we are doing everything that is possible through an integrated program which is driven by EPG, Eminent Persons Group, to ensure equity, access, and demographical spread within sports in South Africa across all sporting codes. And we've got a very clear and scientific program of action that we're implementing. We're no longer talking about mainly emphasizing quotas. We're talking of an integrated process. And our approach to transformation is bottom up. We're not only looking at the national teams, we're looking at development versus high performance and how the two are going to assist us to realize full transformation in South Africa.
Thank you, Honorable Minister.
Thank you very much.
Honorable PG Muteka.
Thank you, Deputy Speaker. Minister, let us talk about transformation quota system that you are silent about these days. Did the minister meet the Afri Forum following his threats to take him to court? Should he insist on making quota non-negotiable in all national sports teams? For interest's sake, share with this House what was the deal with minority lobby group? Where did the money come from? Can it be from our tax? Who actually is in charge of sports in this country? Is the minister or AfriForum? Thank you.
I didn't hear you in terms of your second part of your question. Who's in charge? I'm in charge. That's why you're asking questions. We are in charge. The minister and this government will engage all groups, irrespective. Even those who are conservative in their outlook and don't understand where we come from. And engaging with AfriForum include every citizen in this country who don't share our perspective. So I've spoken to AfriForum. There is no deal or agreement that we have with them. They've raised their voice and disagreement about how they understand the quotas. And we clarified that this is about targets. Transformation is not open-ended and unending process. At some point, we need to talk about targets that we need to achieve in the different sporting codes. And then they spoke about going to the courts. It is within their right. The Constitution says they can, but I said to them, and I want to repeat it to you and for everybody to understand, that this government will not compromise on transformation. It is absolutely non-negotiable. And we are going to pursue transformation, not half-hearted, half-baked, but integrated. In the next 20 years, in terms of the sports plan program we've adopted, we will not only be talking about quotas, we'll be evaluating the impact of the programs that we have implemented. And we have arrived. For those who think that we are on the retreat and we are not going to implement transformation, it is there. Everybody has agreed. In the next couple of weeks, when we are done, we are going to sign an agreement with all our sporting codes. What is your commitment? How far will you go? There will never be a complaint about who is in the bench and not being able to play. The question will be, you as a federation, what do you commit yourself to? And watch the space. We are on track in terms of achieving the targets and engaging everybody in South Africa. Thank you.
Minister. Honorable members, we will go to question 50, asked of the Minister of Basic Education by Honorable van der Walt.
No, Speaker, the department has completed the 75 of the schools since the inception of our CD. Of the 150 schools that we referred, which are referred to in the questions, you will recall that a CD program rollout and implementation has to follow a cycle which includes planning, design, procurement, and finally construction. So that is all. We already have 110 schools which are already allocated to implementing agents. And the completion of the 150 schools is planned for the year 2015-2016 financial year. Thank you, Chair.
Thank you, Honorable Minister. Honorable van der Walt.
Deputy Speaker, thank you. Honourable Minister, the one school a week spin doctoring was to hide the fact that government dismally failed to meet its commitment to eradicate mud and inappropriate schools as per a court order. Government committed to eradicating 496 mud schools by the end of 2013-14 financial year. However, as of on March 2014, only 49 of the 496 schools had been completed. Despite having only provided 49 schools in the first 3 years of this program, you have promised to deliver 150 in one single year. Minister, are you sure you are not making promises to the children of our country that you cannot keep?
Honourable Minister.
Chair, the one school a week is continuing. Yesterday, the Deputy Minister was opening one here in Western Cape. Next week, the President is doing it. The third week, it's myself, and the struggle continues. So it is happening all the time. In terms of, I said 75 schools are finished. The member is going to 45. I said 75 member. And then we're saying of the 150, 110 are already in implementation. If you read our reports, we did ask for a movement. The program started off, it's going up because we had to build capacity. We started off by committing to 45, said 150, 300. That's how we've planned it. So indeed, we've built the momentum. That's why we've moved from 45. We're at 75 now. I'm saying 110 already is with implementing agents. So the program is on track. Just maybe in the words of Minister Mbalula, watch the space. It's all over in all provinces. It brings so much joy to teachers, and it's great.
Honourable Koza.
Thank you, Deputy Speaker. To the Minister, as ANC, we appreciate the commitment of your department for making the ASIDI project work in providing fully comprehensive schools. The question is, Minister, how is the Department of Basic Education and the Provincial Education Department supplement the ASIDI project in providing infrastructure in schools? Thank you.
No, Chair, ASIDI is specific. That's why we shouldn't even be expected to deal with all infrastructure backlogs. ASIDI is special. It's around mud school, so tin schools and wooden schools, and all over the province. So it's 400 and something in the Eastern Cape. We're doing 25 here in Western Cape. We're going to finish 11. We have 30 in the Free State. So and then provinces deal with the other structures, like your new schools are not ASIDI programs. It's only when we remove an old, unsuitable school. So your new schools are provincial. Your renovation, your repairs belong to provincial budgets. Our budget is specific. So it's unsuitable structure, it's water, sanitation, and electricity, and nothing else. Thanks.
Thank you, Honourable Minister. Honourable Mbata.
Honourable Minister, for your record, the question is how many mud schools did you eradicate in the last parliamentary term since you were the minister? And the last one is, what is your target for total eradication of mud school overall and the building of infrastructure backlog, in particular in rural and black townships, since the difference between the schooling system is still widely into color and black kids are still suffering as we speak?
Honourable Minister.
Chair, I've just explained. ASIDI didn't start in the whole last term. ASIDI started towards the end of last term because we had to secure the budget. From that part, we're saying we've completed 75 of those. Not for the entire term, because it didn't start in the entire term. It started in the last years of the term. We're saying now, this year, 2014, 2015, we have 110 schools which are already with service providers, and we are allocating others. So that's the next batch. Then the next batch is going to be 300 and it's only in the Eastern Cape. In terms of the other, which is a question I was answering from the ANC member, the other infrastructure programs are done by provinces. New schools are done by provinces, repairs are done by provinces. We also have a special grant, which is ring-fence money that we give to province and work with them. So if you want the entire infrastructure program, then I don't keep all these figures in my mind, put it in writing, I'll give you the answer. Is that not so? So ask me, I'll give you the answer. But don't ask questions on matters that have not been raised before and expect me to keep all the figures in my head. So if you ask me, I'll bring you the answer.
Thank you, Minister. Honorable Mponjane.
Deputy Speaker, thank you, thank you, Honorable Minister. Yes, Honorable Minister, we are watching the space. When we, as a committee, visited Eastern Cape, we discovered that there were many factors which were bedeviling, putting some spokes on the delivery of schools in that province, which included, inter alia, the tensions and rivalries between among
Honorable Member, remember to ask your question.
We discovered, Honorable Minister, that there were tensions between different grades of construction companies, leading to short work, lack of skilled people. Now, my question, Minister, how have you dealt with each of these factors which were hindering delivery of schools in the Eastern Cape?
So, Minister?
Nokuthi umponsa nokuzazi zonke indaba zakwa-department nenkinga ekhona zinjalo nje obuzicacisa nje Mpuntshane. Inkinga ezikhona ukuthi short work ubunzima nje bokusebenza laphaya nokuxabaxabana. Ngongeza nje kwezinye inkinga ezikhona esozibalile. Nazo sizixazulula one by one ngokuya ukuthi ziziveza njani. So one other problem that we also have not raised, which I think also is slowing our progress, is the fact that some schools we feel have to be consolidated and be brought together. So there's a slight delay, or we're also slagging because some of the schools don't justify a new, fully comprehensive infrastructure. It's 8 children's school, 20 children's school. So we are also parallelly working with the province to make sure that we can integrate schools. So yizokinkinga ikhona ngikhuluma ngesizobabezwa futhi ngithi yona Mponjane bangasibangela umsindo sixoxa indaba yethu kahle. Injobu uyibeka nje ukuthi ziningi inkinga efanele sixazululane nazo. Athi ingane zethu esihlabeka kakhulu makukubi. So sisixazulula kancane kancane ngokuya ukuthi ziziveza njani. Maxatshana siyalamula mabesebenza kabi cancel contract njalo njalo nje ukuthi siziveza njani sizilungise njalo ke inkinga zethu.
Siyabonga ngqongqoshe ilungu elihloniphekile kahle baba. Hayi. Uzomphendula ngelinye ilanga baba okusele kuzongena kwi-answer baba.
Ngiphakamisa iphuzu i-point of order
elithini baba
ukuthi cha bo uMinisa bengabuzi ngimtshela ngeenkinga bengibuze ukuthi lezi inkinga ekhona ke uzoyixazulula kanjani.
Hayi useshilo baba. Usechazile usuphinda. Sesiphelile isikhathi semibuzo impendulo ezisele izobhala kwi-Hansard. We now come to notices of motion. Does any member wish to give a notice of motion? Yes, Honorable Madam.
Thank you very much, Deputy Speaker. I hereby move on behalf of the Democratic Alliance that at its next sitting, the House debates the impact of President Zuma's oversized cabinet on the oversight work of Parliament and its consequences for the economy of South Africa. Thank you.
Honorable Member.
Honorable Deputy Speaker, I move on behalf of African National Congress that on its next sitting, the House debates encouraging community participation in parole boards
and corrections, rehabilitation and integration initiatives. I so move.
Thank you, Honorable Member. Next, Honorable Kubisi.
Thank you, Deputy Speaker. I move on behalf of the NFP that on next sitting day, the House discusses the 2012-2013 Auditor General's report regarding the performance of district and local municipalities.
Honorable Tengwa.
Much Honorable Deputy Speaker, on behalf of the Inkatha Freedom Party, I shall move on the sitting of the House that the House debates the role of traditional leaders in municipal councils. I thank you.
Thank you. Honorable Member.
Thank you, Mr. Chair. I hereby move on behalf of the Democratic Alliance that at its next sitting, the House debates the security risks at government hospitals and discuss ways of ensuring the safety of all people using government health facilities. I so move.
Honorable Member, the back there.
Thank you, Deputy Speaker. I move on behalf of the ANC that in the next sitting, the House debates the role municipalities can play in the implementation of the National Climate Change Strategy. So I move. Thank you.
Thank you, Honorable Member. Honorable Nkutana. Honorable Member Nkutana.
I move, Chair, Deputy Speaker, on behalf of the EFF, that the next sitting, this House discuss the minimum wages for domestic workers because they work under very difficult conditions and they're underpaid.
Thank you. Honorable Member.
Chairperson, I hereby move on behalf of the Democratic Alliance that at its next sitting, the House debates the endemic loss of jobs in agricultural and the deterioration of the economic development conditions in the agricultural value chain. I so move.
Thank you. Honorable Member over there. Cope.
Thank you, Deputy Chairperson. On behalf of the IFP, I shall move that in the next sitting, the House must debate the transformation in built environment. Thank you.
Honorable Member at the back there.
Thank you, Deputy Speaker. I move on behalf of the ANC that in its next sitting, the House debates combating the increase in trafficking of persons, especially women and children. Thank you.
Thank you, Honorable Member. Honorable Member.
Thank you, Deputy Speaker. I move on behalf of the EFF that the House in its next sitting discuss the role of restorative justice in making the perpetrator come to terms with their crime and experience remorse. I thank you.
Thank you, Honorable Member. Honorable Kwankwa.
Thank you, Speaker. I move on behalf of the United Democratic Movement that at its next sitting, the House debates strategies to revive rural economies in order to stem the tide of urbanization. Thank you.
Thank you, Honorable Member. Honorable Member.
Thank you, Deputy Speaker. I hereby give notice on behalf of the Democratic Alliance that at the next sitting of this House, the House debate the grossly irregular awarding of a R4 billion tender on nuclear maintenance to French nuclear firm Areva, despite the findings and strong recommendations of Eskom's own technical committee to do the contrary. I do so move.
Thank you. Honorable Member at the back there.
Thank you, Deputy Speaker. I move on behalf of the ANC that in its next sitting, the House debates on strengthening the economic empowerment of rural women through mobilization of resources and capacity building. I so move.
Okay. Honorable Member. Honorable Nkutana. I'm suggesting that, hold on, you can't repeat, sir. Honorable Member.
Sekela somlomo ohloniphekileyo egameni le-African National Congress ndiphakamisa ukuba le ndlu xa ihlangene kwiveki elandelayo ixoxe kabanzi ngomcimbi wokuphathwa gadalala nodlame olujoliswe ebantwaneni emzimbeni nasengqondweni nangokwesondo. Ndicela ke ukuba ndinjulule ngolo hlobo. Ndiyabulela somlomo.
Ndiyabulela ma. Honorable Member.
Thank you, Deputy Speaker. I hereby move on behalf of the Democratic Alliance that at the next sitting of the House debates the reasons why the lights are continuously left on in this parliamentary precinct while our nation is facing an energy crisis. Thank you.
Honourable Member, I'm coming to you.
Thank you, Chair. I move that the House in its next sitting debate the eviction of farm workers residentially. Thank you.
All right. Honourable Member.
Thank you, Deputy Speaker. On behalf of the IFP, I've moved that this House at its next sitting debate the South African Medical Council report tabled in Parliament today on the increasing number of child murders in South Africa. I thank you.
Thank you. Any other motions? None. Thank you, honourable members. Motions without notice? Honourable Chief Whip.
Honourable Deputy Speaker, I move that this House notes on Thursday, 28 August 2014, President Mandela's widow and human rights activist, Graça Machel, received the Mahatma Gandhi Award for Peace and Reconciliation at the Kendra Hall in Greyville in Durban. Further notes, the former First Lady of South Africa and Mozambique received the award from Gandhi Development Trust and was handed over to her by Ella Gandhi, Mahatma Gandhi's granddaughter. Remembers that on the night of the award, she delivered a speech on suffering and disrespect of African women, especially in war zones like DRC. Recalls that on Thursday night, Ms. Graça Machel, who is also passionate about helping millions of destitute children in Africa, was speaking as a chairwoman of the African Center for Constructive Resolution of Disputes, ACCORD, and congratulates Ms. Graça Machel on her well-deserved award. I so move.
If there are no objections, I put the motion. Agreed to. Next, member.
Thank you, Deputy Speaker. This House notes that on Sunday, South African golfer Henny Otto claimed victory in the Italian Open held in Turin. Also notes that this is Otto's second victory after laying claim to the same title in 2008. 3 further notes that Otto shot a 4-under par 68 to finish with 20 under, total of 268. 4 congratulates Henny Otto for flying our nation's flag high and wishes him the best of luck in his career and future endeavors. I so move.
If there are no objections, I put the motion. Agreed to. Next motion. Yes, honourable member.
Thank you, Deputy Speaker. This House notes that from Thursday, the 4th to the 7th, maidens celebrating their Zulu culture will come from all over South Africa and converge at Enyogeni Palace in Nongoma, Zululand. And during this ceremony, maidens participate in singing and dancing. And the older women teach young girls how to take care of their bodies and promote chastity until marriage and to respect themselves. Therefore, we move to congratulate His Majesty the King, the Zulu monarch, for reviving the reed dance ceremony, which has contributed immensely in the fight against HIV/AIDS and teenage pregnancy, especially in KwaZulu-Natal. Also note that reed dance also promotes tourism in the province, which is the biggest economic driver. Thank you.
If there are no objections, I put the motion. No objection. Yes, honourable member.
Thanks, Deputy Speaker. I move without notice that Shakes Mashaba, the coach of Bafana Bafana, be provided with all the support and not be attacked even before you have started this work. So hands off Sheikh Mashaba, let's give him support so that he rebuild the national team.
If there are no objections, I put the motion. No objection. Honourable member. Honourable Chief Whip.
Deputy Speaker, I move that the House notes
that on Saturday, 30th August 2014, Olympic gold medalists James Thompson and John Smith realized a lifelong dream after claiming first place in the lightweight men's double sculls at the World Rowing Championships in the Netherlands. Further notes, the time they set was the best result in history at a global event by a South African crew. Recognizes that Thompson and Smith further etched their names in the annals of South African sports history as the country's first world champions, only 2 years after they famously won gold at the London Olympic Games as members of the lightweight force with Sizwe Ndlovu and Matt Britton. Recalls that South African duo was up against quality field, which included defending world champions Norway and pre-race favorites France. Congratulates Thompson and Smith for raising the South African flag high and demonstrating the same tenacity they showed at the Olympic Games 2 years earlier. I so move.
If there are no objections, I put the motion. No objections, agreed to. Any further notice? Yes, Honorable Member.
Thank you, Honorable Chair. I move that the House marks and recognizes the 30th anniversary of the Val Uprising of the 3rd of September, 1984. That the people of Everton and Sebokeng protested against the increments on rents and other tariffs imposed by the Lekwa and Everton town councils. The resistance brought together social movements, student movements, trade union movements in a united front against the oppressive apartheid state. This led to the biggest and longest black uprising which exploded in the history of the anti-apartheid struggle. That we shall continue to recognize the many people who fell on that time, and that we shall continue to be inspired as well to make sure that our people access economic freedom in their lifetime and quality services. I so move.
If there are no objections, I put the motion.
No, Deputy Speaker, there's no objection, but again, that motion was not circulated to the Democratic Alliance.
Okay. All right, honorable members, please follow the practice of circulating the motions and so on. Okay, agreed to. Any further notices of motion? Okay. Done. The last item on the order paper is a motion in the name of the Chief Whip of the Majority Party. Chief Whip.
Honorable Deputy Speaker, I wish to amend the motion as it appears on the order paper and move as follows. That the House resolves that notwithstanding Rule 106, subsection 5, the time allocated for party responses to executive statements for Thursday, the 4th of September 2014, be as follows. ANC 20, DA 8, EFF 5, and all other small parties 3 minutes each. I so move.
Okay. I now put the motion as amended. Are there any objections? No objections, agreed to. Honorable members, that looks and sounds like the conclusion of the business of the day. The House is adjourned.